All right, we're going to move on. And when you hold the time is up, Sign, if you could just hold it up for a little longer, sometimes it's not seen necessarily. Okay, we're going to move on to Health Information Technology from the Department of Veterans Affairs. We're joined by Jonathan Perlin and Robert Lynch. Thank you, sir.
Well, good afternoon. In America today, 1 out of every 7 hospitalizations occurs because clinicians don't have access to previous records. 1 out of every 6.5 hospitalizations are complicated by medication errors. And 1 out of every 5 lab tests are needlessly repeated because previous studies are not accessible. But thanks to a rigorous system of performance measurement and improvement supported by VHA's electronic health record called VISTA, veterans cared for by VHA now receive what is referred to as the best care anywhere. VISTA enables VHA clinicians to view electronic health records, including images, throughout VHA's 1,400 sites of care. It's computerized provider order entry with decision support and error checking, links to automated drug distribution, and has reduced our drug error rate from 5% to 6 sigma. It supports telehealth outreach to rural and isolated veterans. And it is the foundation of a personal health record system that helps veterans successfully manage their own health care and improve it. While other electronic health records exist, VISTA is innovative because of its unique linkage with systematic, rigorous performance measurement. Our electronic health records provide time and context-sensitive clinical decision support and fuel a performance measurement system that has driven evidence-based practice to better and better outcomes for veterans, despite the fact that our diverse and vulnerable patient population is older, sicker, and poorer than the average American. Let me give you one example: pneumonia vaccinations. VISTA's ability to link decision support and measurement improved our rate of vaccinating veterans with emphysema, and this ended up saving 6,000 lives. For all veterans, VA's benchmark vaccination rate has cut pneumonia hospitalizations in half, even while our patient population has doubled, and it reduced taxpayers' costs by $40 million. VA measures performance in 6 areas: quality, access, satisfaction, restoration of function, community health, and cost effectiveness. For results, here's a quick report card. In quality, a recent RAND study found that VA outperforms all other sectors of healthcare on 294 comparable evidence-based indicators of quality in disease prevention and disease treatment. Access. VISTA supports greater efficiency, allowing us to have added over 600 outpatient clinics in the past few years, changing our focus from intervention to prevention. In satisfaction, the American Customer Satisfaction Index found that VA is the benchmark for inpatient, outpatient, and pharmacy services in healthcare for 6 years running. And in function, a recent study showed that we have the rate of amputations in diabetes, setting the benchmark for diabetes care. Cost effectiveness. Today's VA offers benchmark levels of quality, satisfaction, access, and function for exactly the same cost per patient as 10 years ago. And VISTA costs us about $80 per enrollee per year, less than the cost of repeating most lab studies only once. Finally, Dr. Lynch will explain how VA saved the day for 40,000 Gulf Coast area veterans displaced by Hurricane Katrina, and show how our innovation helped to save and improve lives in an extraordinary way. Dr. Lynch?
Thank you, Dr. Perlin. When Hurricane Katrina hit the Gulf Coast, tens of thousands of people evacuated, leaving behind their health records. Most of those records were destroyed, or other records were not available as hospitals and doctors' offices remained closed. As these thousands of vulnerable people sought health care in new locations, a health care crisis developed, but not for our VA patients. As Time magazine wrote of VISTA, doctors treating displaced patients in the VA system have access to information those outside are dreaming of. Although our Gulfport Hospital was completely destroyed and our New Orleans Hospital evacuated, Gulf area veterans had their clinical information, including test results, diagnoses, therapies, written notes, available through VISTA throughout the nation. One of our patients was trapped on his roof in New Orleans for 8 hours and lost everything. Using information in VISTA, he quickly had new medications, glasses, and even an electric scooter. Our cancer patients with complex diagnoses and even more complex therapies were quickly enrolled back in treatment as they appeared in new locations. These real stories, and thousands like them, contrast with the tremendous effort and dangerous delays required when non-veterans sought care without any medical records. VISTA saved time, money, and lives. The hurricane was the ultimate demonstration of the value of our electronic health record system.
VISTA and its linkage to performance measurement bring us ever closer to our goal of providing veterans and all Americans with safer, more effective, more efficient, and more compassionate health care. Thank you so very much for the honor of allowing us to share this innovation with you.
Thank you. It's Ed Dorn and then David Osborne.
Veterans are eligible for health care because of illnesses or injuries traceable to their military service. How good or how robust is the transfer of information from the Department of Defense to the VA?
Well, as the Department of Defense is bringing online electronic health records, more of that is available electronically in our VA hospitals. And our goal is to have interoperable systems so that each and every individual who served has his care informed by all of the past experience. In fact, we were recently visited by a Congressional Oversight Committee, and they asked just that question. We were able to show how some of the data that's electronic now in DOD, which exists, comes into VA, and we're able to take care of patients based on that information.
I hear you saying it's got a long way to go.
It's got some opportunity. We have our health record fully deployed throughout the system, and are working with our colleagues to make this available for all veterans and all service members.
David?
One of the most intriguing statements in the site report to me was that one of the reasons this worked was the management of the Veterans Health Administration took a decentralized approach. And I guess you have regional units called integrated service networks. And they were given a fair amount of flexibility in return for some very clear accountability for results. Can you talk about what role that played in helping you achieve what you've achieved?
Yes, we don't believe that we should micro-specify every process, but we believe with shared values and clearly stated performance objectives in each of the 6 areas, quality, access, satisfaction, function, cost effectiveness, community health, we can achieve better outcomes for veterans. The electronic health record is really the engine. It provides a support system to inform the clinicians and administrators with the information. It also provides the trail of data, which provides the accountability and the mechanism for improvement. One example is that, quite frankly, we probably could not be here doing what we're doing today if, with the doubling of the number of veterans we take care of and an increase by 50% in the cost of health care in the country over the last decade, it's likely that if we had continued on the trajectory, we would have faced an untenable budget of $60 billion and not 30.
Bill Klinger?
Yeah, and your application indicates that there's a gap. That one of the gaps that you have to deal with is how you get access to private health records of veterans who have services and health dealings outside of the Veterans Administration. How do you propose to close that gap?
Well, veterans' health information is available throughout the entire system within VA. The rest of the world is frankly not electronic. We estimate that about 8% of providers, physicians enter information directly, and maybe there's 17% availability of systems throughout the country, according to the most recent Harvard study. The truth of the matter is that we'd like to help fuel the adoption of electronic health records in the country, and we're working with Secretary Leavitt and AHIC to make VA a model for developing standards and creating some means to close that gap to improve the efficiency and effectiveness of healthcare nationwide.
Can I ask you about the money side of this first? For many hospitals that beyond VA, the big barrier seems to be the cost, the initial investment. Were you able to do this because you were a large governmental organization and how big a barrier is that for others for replication?
Well, there was no venture capital, and so it was through increasing efficiencies through the use of the record, and we think the appropriate question is not can we afford to do this, but how can we afford not to do this?
Well, but did you have to make some initial outlays?
Yeah, we did have to make some initial outlays, but as we created some efficiencies through the application of the system itself. For example, not repeating lab tests, and even with the doubling of our patient population, having that information, moving to a preventive model, cut hospitalization rates in half.
And what is now the inflation rate for VA care versus the rest of the nation?
Well, we estimate that in fact, well, let me just tell you in real dollars, between now and 10 years ago, the cost per patient is exactly the same. In real dollars, it's actually deflated 32% over time.
And versus the rest of the nation?
Well, it's 50% over that same 10-year period.
50% up?
Over the 10-year period for the country.
And you've had a cut in real terms?
The resources per patient are exactly the same. In real terms, it's more efficient.
How did you do it? I mean, it's, you know, everybody says we're supposed to, you know, it's the private sector, and here you are in the government program, and you've done this extraordinary, you've gotten these extraordinary results.
This is really a grassroots. There was no master plan laid out back decades ago to do this. It was sort of an iterative approach developed from the bottom up. Platform architecture, the technology pieces were sort of centralized, but in terms of creating the functionalities, our clinicians drove this process. And I think that was a unique advantage that we have. And
Your clinicians drove it.
absolutely. Many of our best people who participated in writing the code are clinicians.
So it's sustainable then, too.
So it's what?
Sustainable.
Sustainable.
Yeah.
Thank you.
Gentlemen, the time is up. Thank you very much.